Hi, everybody. My name is Lisa Kessler, and I am here today on behalf of Cheers for Charity New Hampshire with my dear friend Joanne. Hey, Joanne.
Hi, Lisa. Yes, hi, I'm Joanne Burchuck with Lighthouse Physical Therapy, and I would love to introduce our next guest, which is Towny Manfull, and Towny is representing the Alex Manfull Fund. And please, Towny, welcome and introduce yourself, and then tell us a little bit about your organization.
Well, thank you. And I'm Towny Manfull. I'm co-founder of the Alex Manfull Fund, along with my wife, Susan Manfull. And we were established, we actually started an organization 5 years ago when we lost our daughter to a little known condition called PANDAS. And that stands for pediatric autoimmune neuropsychiatric disorders associated with strep or streptococcus. And it's obviously still a very painful subject for us as we lost our only child to this condition, but our daughter, after she was diagnosed, after about 4 years, said, when I get better, I want to make sure everyone knows about this. And in some ways, we feel like we're continuing the mission that she wanted to pursue. Um, so to that, in that pursuit, we set up a fund about 5 years ago and officially became a 501c3 2 years ago. And we are based here in Portsmouth, New Hampshire. But our organization really is focused on three different pillars. So first is awareness. There's not enough awareness of this condition. It took our daughter 4 years to be diagnosed, and she ended up actually diagnosing herself and then seeking treatment for it. So it's a condition that early on it can be easily managed through very simple treatments. As it progresses, it becomes more chronic. At that point, requires a higher level of treatment. So early diagnosis is critical, and that's why the awareness is very important. Since strep is so pervasive, every family knows about strep. It's critical that families also know that they could have very sudden onset of conditions that require serious intervention. The second piece is education. So part of the problem is that there's just not enough physicians out there, clinicians that have treated these conditions or recognize these conditions. So we're very active educating not just clinicians and researchers in this space, but also parents and people that do have the condition. So examples of what we've done on the education side, we will be this year hosting our third symposium for clinicians and for researchers. And our last one, which was 2 years ago, attracted the best and brightest in this area from Europe and the US. So and that was hosted in Portsmouth, and it'll be hosted again in Portsmouth. And then the last piece is research. So obviously, research is very expensive, for an organization that's 2 years old, but we've had such great success with our local community and actually a global community in supporting our efforts that we, for the first time this year, were able to make a sizable investment in research. For example, MGH Harvard we underwrote some research that will start this year, as well as we are finalizing a fellowship at Dartmouth, another New Hampshire, clinic that's here, that's world class. And we're also talking about doing another fellowship in Georgetown University. So we're very proud of our accomplishments in a short period of time, and we could always use more help and more resources. So
Oh my gosh.
get
Wow.
the word out there. We appreciate it.
You guys have accomplished a lot in a very short time. Yes, you should be very proud of what you've done. That's fantastic. I have heard of pandas, but I really wasn't aware of how you would know if you had that. So do you want to just speak for a second on, what are signs that people should be looking for?
Sure. So typically, the signs, it would be a post-infection symptoms that come actually quite suddenly. So the typical symptoms that people would recognize would be OCD, which would come shortly after an infection. The PANDAS, the P in PANDAS stands for pediatric, and our daughter really didn't have strep as a child that we know of, but had this condition later in life when she did have strep and possibly another infection. So it is primarily pediatric condition or recognized as pediatric, but we know that it also affects young adults and adolescents, and we're also focused on getting that story out as well. But OCD would be one typical symptom. Anxiety would be another one. And often what happens is that these symptoms appear neuropsychiatric, so that as opposed to looking for an infectious cause or medical cause to these symptoms, they often are referred to the psychiatric side of things. And then the treatment plan there is not effective at treating this, that you really need to treat it with antibiotics, long-term antibiotics, and even some more, some more serious options. But it appears to be psychiatric in symptomology, but it turns out that it's really an infectious cause, and you have to fight the infection first before you treat the other things.
Right.
So I would say those are the key. There's a whole list of other symptoms. It is a wide range, so different people present differently. And if you kind of think of if you think of long COVID, that would fall in this similar symptomology. Or if you think of perhaps Lyme, are people that probably recognize those conditions more readily. But it's the same sort of thing, is that you have folks responding differently to this. But it's essentially something that dysregulates your immune system, and your immune system looks to combat the infection, and the auto antibodies pass the blood-brain barrier and they get into the brain and cause brain inflammation. That's why you see these symptoms. We don't quite know why, and that's part of what we're trying to do in the research areas, to get a better understanding of what causes this and what triggers these infections. But it's basically triggered by infections, viral, bacterial, could even be, Coxsackie, flu, any number of conditions.
Yeah. Well, that's important to know what to look for when, somebody starts acting, because those particular symptoms you would normally think psychiatric first. So that is great information to know. How much is this occurring? Is this becoming, do you feel more frequently now? Are the numbers increasing? So, getting this information out there, or do you think there's been a lot of people that have had it and just never ever got diagnosed?
That's a great question. I would say all the above. So there's no good prevalence data, and that's something people have thrown around numbers. We believe that those haven't really been properly determined. But I think that part of the problem is that it does have a wide spectrum of seriousness of condition. So the more minor conditions may be undiagnosed, so the number may be larger than we think. When you have a more chronic case, it is obvious to everyone. In fact, parents will often say that they can almost tell you the day that things changed. After an infection, they can tell you, yes, it was Wednesday, April, whatever, that they saw a sudden change in the behavior of their child. And so I think the obvious cases are easy to measure, to say, and I think what happens is, with what we're doing with awareness and education, you probably have more diagnosis, which would actually escalate the number. So I would say it's growing, but only, based on anecdotal type of, more doctors seeing more patients.
Yeah. And are you finding getting this information really into more the pediatric population, those type of doctors and neurologists too, I would guess, psychologists, things, where they're able to look for those symptoms as well.
So the challenging part of this is that it touches so many disciplines.
Right.
So you have, obviously, your pediatrician should be knowing your child and seeing a change and being able to recognize it. But it touches infectious disease, it touches neurology, it touches pediatrics, it touches rheumatology when it gets into the immune system. So really what seems to work, because there's no blood test for this, there's no biomarker that can definitively say this was what it is. It's basically a clinical diagnosis. So you have to look at the history, you have to look at the infections, have looked at everything. So often it takes more of a team approach of saying, why did these symptoms occur when they did, and so suddenly when they had no history of this before, and then have to go through and diligently go through the history to determine. But if you have someone who's experienced this area, they'll be able to know the common symptoms and piece it together to come up with a proper diagnosis. So yeah, so it's somewhat complicated. It's not a simple diagnosis, which is why a lot of people haven't heard of it. So yes, that's one of our goals, is really to make it easier for people to, and some of the research we're doing is helping to look for a diagnostic means of diagnosing things more readily.
Mm-hmm. Yeah, very, very tricky. And so once somebody has that, you said early intervention is the key, getting them on antibiotics. And have they been able to reverse when it's diagnosed quickly and treatment, are they able to reverse that, or?
Yes, there's actually many success stories where and actually can be as simple as taking something as simple as naproxen to manage inflammation along with antibiotics, and it's pretty, if you catch it early, it's quite easy to sort of knock out the infection and sort of not have a continuation of the symptoms. So and then as it gets, if it progresses and becomes more chronic, then there are treatments such as IVIG, which is and rituximab and these other treatments that are used in other conditions that have been sort of used off-label for treating pandas, that are very effective as well, but very expensive, and often because it's an off-label use of the drug, the insurance companies don't pay for it. And these are drugs that are in the $50,000 a month type of treatments if you need it. So early diagnosis is very cost effective. Later, it's and what this condition does, it really affects the entire family and schools, so that usually you see behavioral issues in kids that have this condition, which makes it difficult for them at school. If insurance isn't covering it, then you have parents that are advocating and going through multiple rounds of claim appeals to be able to get insurance to cover it. So it's disruptive to the entire family.
Sure.
Which is why, if we can make it easier for these children and young adults and adolescents to be diagnosed early, it's frankly better for the community, it's better for the schools, it's better for the family. So it's an important message to get out there.
Yeah. Win-win for
Yeah,
everybody.
absolutely.
Yeah. So it sounds like on the research end too, Lisa, did you have something you jumped on? I just
I can wait. I'll ask the next question.
Okay.
Yeah, so I was just gonna say on the research end, it's amazing that you guys are able to get those funds out to these great universities and medical centers to, help support the research in this area. So That's fantastic. It wasn't really a question, it was kind of a statement.
Yeah, well, thank you. We're very pleased as well. And of course, the more funds we raise, the faster we can accelerate research and faster we can get more physicians trained and more people looking at this condition. So, I'm on other nonprofits, and this year was a very tough year for nonprofits. And knock on wood, we've been able to greatly increase the number of donors that we have and raise, because I think we are having impact. And it does take. There's no organization at this point in this space that's large enough to underwrite a large research project. So a lot of what we're doing is seed type funding so that the research gets launched with the hopes that the outcomes are significant enough that NIH or one of the other larger funding institutions will then sort of take it up from there. And clinical trials are very expensive. That's probably out of our scope for now, but it's we're building towards having that level of impact.
Awesome.
So this is fascinating, and it's incredible work that you're doing, and it's incredibly important. As a mom who raised 3 kids, like, I can't imagine not knowing what's wrong with your kid, right? And the fact that you can help eliminate that feeling, that fear, that part of feeling so inadequate, right? Like, is incredibly important. And so I'm so grateful for the work that you're doing. How can the community that we touch on support you? What do you need?
Well, we have a wide variety of needs. So, for example, one of the things that we do try to act locally where we can. So we've done a fair amount of education at the school levels, where we've met with school nurses, we've met with teachers to help them, recognize these symptoms. They, of course, are very aware when strep is going throughout the school, and to help them look for signs if they see any behavioral changes or see any, handwriting, for example, something that's very affected by PANDAS, and you see it almost immediately. Those type of signs that this person, needs help if you see a dramatic change. So how the community can help is, open doors to us to come in and talk. So we'll share our knowledge with anyone who would like us to go in and share. Obviously, donations are for us critical to the research component. And then we do some very interesting events. So our daughter Alex went to Phillips Exeter. She was a coxswain on the crew team. She was recruited by Princeton to be a coxswain. So she had a very wide network of crewing, or, rowers that remembered or that were in her boats. And we just entered a boat into the Head of the Charles this year, where some of her former rowers and friends that, rowed got together and put an application in for the Head of the Charles and put together a boat. And that was very much a public event. Over 400,000 people go to the Head of the Charles weekend every year. And that's a way that that we were able to get our message out there and get the awareness out there very widely, is having events that where we're trying to reach an audience that has not heard of us or heard of PANDAS or PANS, and whereas those that already have had this as as part of their life, unfortunately, are greatly aware, do a lot of research, and discover us usually. So it's what else people can do is pull together and even propose an event if that makes sense for us, because what we're looking to do is reach as many people, both on the public side as well as the medical and research side as well.
Oh, sorry, I'm taking all this down. It's a bit of information. I was like, oh my gosh.
Yeah.
Incredible what you've been able to do already in such a short period of time. What an honor to your daughter. Incredible. We really want to thank you for taking the time to share this with us, and tell us this story. It's so inspirational and so important. And thank you for being part of our family and Cheers for Charity and sharing.
But it's our pleasure as well. Thank you for giving us the exposure. And I encourage people to go to our website, look at, there's a lot of information about what the symptoms are, et cetera, and become more aware of this condition and spread the word.
Thank you. Definitely. We'll tag the website for sure. So
Right.
thank you.
Okay, thank you. Thank you both. Appreciate it.